Let's talk about why low back pain is actually really mysterious. Pain science education is really popular these days, and it makes people feel that pain is all in their head. And on the other hand, we still have people that are scaring the crap out of people with exercise and manual therapy and physical therapy, telling them that their bones are out of place and that they're all out of alignment and that if they don't move a particular way, they're just gonna explode. I'm gonna share some research that I think helps to bring clarity to this complex issue. And I'll discuss why pain science, the things that they say, and why biomechanics, the things that they say, for the most part, they tend to say things in both camps that are totally accurate. However, both of them are completely missing the bigger picture here. At the center of this awesome diagram that I found here, we have pain. In this context, we're looking at pain as an undesirable outcome, something that you don't want to have. But as you can see, there are other circles here like quality of life. Here we have disability, we have restricted activities, neurological problems, physical impairment, walking problems. These are all things that you don't want to have. Now, as you can see, each of these undesirable outcomes has millions of little tiny lines connected to that. So let's zoom out and see what that's all about. If anybody ever tells you that pain, your pain, has one specific cause and they can fix it, they are lying or they don't know what they're talking about. Pain is influenced by many different factors. On the bottom of this image, you can see these general categories. We have individual factors like age, genetics, or family history of pain. We have psychological factors like fear or a positive mood. We have biomechanical factors like posture and strength. We have nerve stuff, basically how do your nerves work? That's like central sensitization. Of course, we have a category for injury. If there's something in your body that is physically damaged, that can contribute. We have behavioral and lifestyle factors like leading a sedentary life or getting poor sleep. We have contextual factors, which might have to do with the actual place that you go to receive healthcare or the person who acts as your healthcare provider and their beliefs. And we have social and work factors like socioeconomic status, and even your personal or religious beliefs can impact your amount of pain. So let's do a little thought experiment. Let's come up with an example of pain that we would typically ascribe to being tissue damage. There's something, oh my God, damaged in your body. So let's talk about degenerative disc disease. That's really a big one. So if we zoom in here to the category of tissue injuries here, we have degenerative disc disease, and it does represent a very large bubble. There's a lot of research on it, and people tend to attribute it to a source of pain. And it can influence pain. There's plenty of research showing that degenerative disc disease can influence your amount of pain. But let's pretend that we could snap our fingers and have a magic genie pop out of a lamp and cure the low back, the degenerative disc disease. So now your spine is magically perfectly healthy. Great, you just removed one bubble out of, I can't even count how many bubbles there are in this chart, right? You still have all of these other tons and tons, dozens and dozens of factors that are influencing your ability to feel pain. Your lifestyle may still be contributing to pain. You might be sedentary. You might not be getting enough sleep. Chemically in your body, you might have central sensitization or inflammation that can make it easier for you to feel pain, even without tissue damage. Maybe you've lived with low back pain for years, and so you've got psychological factors because, man, it sucks to have chronic pain, and yeah, that stresses everybody out. So that stress can make it easier for you to feel pain. Maybe your beliefs or your spiritual beliefs make you, or your lack of spiritual beliefs make you not believe in genies, and so you don't believe that the genie actually healed your back, even though the genie swears on it. And so because you don't believe in genies, even though the genie did actually fix your degenerated discs in your spine, you still feel pain because you don't believe the genie healed you. The point is, you've got a ton of factors that are influencing pain, and even if you can fix a tissue, it doesn't magically erase your pain experience. But here's the deal. So if you're really into pain science, the opposite is also true. So let's say that the body is safe and we look at all this pain science research and we say, oh, it doesn't matter how you move. It doesn't matter if you have a degenerated disc. It doesn't matter what kind of alignment you have in your spine. It doesn't matter what kind of posture. It doesn't matter how you exercise. And basically pain is just all in your brain. So have a better attitude. Well, okay, great. So let's have a better attitude. Let's assume that now we're a different person. We believe in genies, and we have a genie that snaps their fingers, and they take away our negative attitude. They make us really believe. In fact, maybe that's the wish that they grant. Genie, make me believe that I'm healed. So great, you believe 100% with magic powers that you are healed. Well, guess what? If you still lead a crappy lifestyle where you don't get good sleep, nutrition, you don't surround yourself with good people, you're sedentary, you don't perform good exercises to make your tissues nice and strong, then you've still got tons of other bubbles that you didn't magically erase. So you still very well might feel pain. Now, if you looked at this individual map for an individual human being, each of these bubbles might be bigger or smaller, depending. But your goal in working with your healthcare team should be to identify all of the possible contributors to your pain, including biomechanical factors, lifestyle factors, as well as psychological, emotional, mental health factor. And again, you should have a healthcare team that can be on your side, be in your corner, cheer you on, and guide you on your path to health. So if anybody tells you that they know the one and only cause to your pain, they're full of shit. Now here's another way of looking at it. We're up in the top left here. We basically see a human being, if they come in with low back pain, then they're going to have certain modifiable factors like their beliefs, emotions, behaviors, physical strength, and lifestyle. And they're going to have certain non-modifiable contributors to pain, things like their society, their economics, their genetics, and they can't really change these things. And we see that a combination of their modifiable and non-modifiable factors can influence this stuff out at the top right. At the top right, this represents their person's valued goals, such as lifestyle. What do you want to do? You play sports? What kind of functional activities do you like to do? Do you like to travel? And your pain might get in the way of doing those things. And then here at the bottom, we have this interaction that occurs when a patient sees a healthcare provider. And we see that this interaction, actually the beliefs and attitudes of their healthcare provider, the training of their healthcare provider, the communication that they use, their actual ability to use clinical reasoning skills. This understanding and how they are guided along this path can also directly influence their functional goals. And therapists can either positively or negatively affect a person's health. And this happens all the time. Now, real quick, I'd love to know if you have questions about low back pain. I am making a low back pain rehab course, and I'd love to know what you want to know about low back pain. Here are all the references that I've gathered so far. But if I don't answer your questions, then I'm not really doing you any help, am I? So comment below if you have questions about low back pain that you'd like me to answer. The important takeaway here is that back pain is indeed mysterious because it is influenced by so many different factors, some of which are in your control and some of which are totally outside of your control. So it's really important to stay optimistic and understand that you have some things that you can do to modify your pain experience, right? It's important to understand that a certain biological structural damage is not the only thing. It's not going to doom you to a lifetime of pain. But it's also important to remember that we don't get naive and think that structure and form and posture and sleep and these kinds of things don't matter at all. They do matter, but they're just one drop in the bucket. Just like any factor, they're all just drops in the bucket. If the bucket overflows, you experience pain. So we want to build you a bigger bucket. That's usually strength training and resilience, and we want to bail water out of the bucket, and that's working on therapy, whether that's physical therapy or mental health therapy, it doesn't really matter, but it can also be in the form of working on your lifestyle, your economic status, your jobs, your relationships. All of these things are legitimate therapies for low back pain. They actually do influence your pain. If you have questions, leave them in the comments. Be sure to like and subscribe, and I'll see you in the next video.